We live in a youth-focused culture. Being young is considered a virtue, and staying young is an obsession. And the truth is, our nation is aging. In the past 40 years, the longevity of American citizens has increased by 8 years and continues on that track. Many older individuals live independently their entire lives, but most will, at one time or another, depend on others to assist them with activities of daily living. As you watch this video, you may already be providing such assistance to one or more of your family members, and you may find yourself in the midst of one of the most difficult challenges of your lifetime.
We had planned to take care of her at home, and it was hard to put her in a nursing home and not be there to see about her, see after, that sort of thing. But it was the best decision. It was the best decision. She has done well.
Life Care Centers of America, the company that manages this facility, understands your concerns. In fact, many Life Care associates throughout the country have faced the same decision. Our chairman and founder, Forrest L. Preston, describes how he felt when he realized his mother needed long-term health care.
Placing a loved one in a nursing center is a very emotional experience. I know it was for me. Although my parents wanted me to become a doctor, they were very supportive when I decided to build and operate nursing centers. As far back as 1970, when the first one opened, my mother would say to me then, and often down through the years, "Son, I'm so proud of what you're doing to serve people, but don't you ever put me in one of those places." I had hoped she could live at home for the rest of her life. But in 1996, after she had fallen at home and fractured her hip, it was necessary to admit her to a skilled nursing center. As she healed and became well enough to go back home, I delivered the news to her. It was interesting that she made the decision to remain at the facility. She said she had made many friends among the residents and the staff. It was also a convenient place for her friends in her neighborhood and around town to visit her there, she said. I was grateful for the service and for the environment created by this staff that changed her mind.
No matter who you are, it's never easy to accept that your loved one needs long-term health care. But sometimes the most difficult decisions are actually the most loving ones. Thank you for choosing Life Care Centers of America as your nursing care provider. Life Care's mission of service began in 1976 when Forrest L. Preston founded Life Care Centers of America, a company which has gone on to change the face of long-term health care in our country. He developed facilities with home-like environments, where it's the objective for knowledgeable, caring associates to place each resident's needs as top priority.
When she was a young lady, men absolutely had to ask permission to get a little kiss. But nowadays we do it a little different, and it brings out the color, right?
Did anybody ever tell you he was a flirt?
Life Care's dedication to providing compassionate care to America's elderly is even stronger today. And while Life Care always looks for ways to enhance the healthcare profession, we measure our true success every day by the quality of care we provide to each resident we serve.
We are blessed to have been able to touch so many lives over the years. Each resident is special, and we strive to ensure that each person entrusted to our care receives the best care possible. We're not perfect, but here at Life Care we strive for perfection each and every day with each resident we serve.
All nursing facilities must maintain substantial compliance through government regulations just to operate. Life Care strives to go beyond what is expected to excel in the provision of care. Excellence in the nursing profession is identified by a non-government body, the Joint Commission on Accreditation of Healthcare Organizations. This organization sets high standards for providing high-quality care. Since the Joint Commission established its long-term care accreditation program in 1966, only 13% of all nursing facilities in the United States have received accreditation. However, within Life Care Centers of America, we are dedicated to earning 100% company-wide accreditation. Life Care Centers of America was one of the first long-term healthcare companies to develop a program that measures specific performance criteria and gives a detailed view of quality care practices within each facility. The data we gather at regular intervals allows each facility to easily recognize areas of care that need to be enhanced. Since the program is conducted company-wide, it also allows facilities to share best practices in certain areas, continuously improving the standards of practice. In a continuing effort to enhance our quality of care today and tomorrow, Life Care Centers of America remains one of only a few companies to sponsor an administrator in training program that provides mentoring and comprehensive hands-on training for future facility leaders. Life Care has also developed numerous scholarships to assist future healthcare providers with their education. We're dedicated to providing at least 200 scholarships to bring nurses from other countries to this country each year. We've worked with prestigious universities and organizations, including Vanderbilt University and the Mayo Clinic. Education is very important to the professionals who serve in our facilities and to the families and friends who want what is best for their loved ones. Even before a baby is born, expectant parents learn as much as they can about the years ahead, what to expect, how to react to certain issues, and how to set realistic expectations. As our loved ones age, it's important to continue our education process. The more we understand about aging, the better prepared we are to deal with challenges, develop realistic expectations, and make educated decisions about healthcare options. Life Care Centers of America has prepared this video and other materials to provide realistic information about the aging process, describe what to expect in a community living setting, and explain how family member involvement is vital to the overall quality of life loved ones experience at home or in a healthcare facility. It is our commitment to assist you as you make important, loving decisions that benefit the people you care about most. Each season of life holds special memories, accomplishments, and challenges. Our environment, personal choices, family history, and other factors determine a great deal about our experience through each stage of life. Everyone's life journey is different, but as we age, there are common physical and psychological changes we are all likely to experience. The longer we live, the more these normal factors of aging may affect our quality of life and level of independence, whether we receive care at home or in a healthcare setting.
Have you got everything you need?
Yes, I think so.
Okay, well, I'll pick you up for church tomorrow about 9.
Good. I'll wear my new dress.
Bye.
Bye.
Mom? 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 Mom, are you okay?
Sometimes an individual's level of independence lessens gradually, but dramatic health changes often occur in an instant. Some of these changes can be affected through treatment, therapy, and supervision, but no caregiver, whether he or she is a family member or a healthcare professional, can stop the aging process, nor can they eliminate death as the final stage of life. Going into nursing facility placement with realistic expectations and your active participation in your loved one's care will make the transition much more positive. Frequent family involvement helps combat depression, a condition that many elderly individuals suffer from. Be sure to visit often and provide meaningful interaction with your loved one. Your visits enhance your loved one's quality of life and allows you to more closely observe their health changes. Life Care considers you a key partner in developing a specialized care plan for your loved one. In fact, we feel that the best way we can provide compassionate care is when the resident, family members, and clinicians communicate freely about changes, needs, and desires. The caregivers at our facility will most often be unable to cure the diseases and conditions your loved one experiences, but they will provide knowledgeable care practices and loving compassion. It is our goal to manage these changes in a manner that enhances health, safety, and quality of life. As discussed earlier, each individual experiences the normal changes of aging differently. We'll review some of the most common issues associated with aging, such as nutrition and hydration, incontinence, infections, chronic pain, falls, skin ulcers, medication and side effects, and dementia. The risk of nutritional decline in the elderly is great regardless of whether they reside at home or in a long-term healthcare facility. Recent studies have found that 85% of the elderly are nutritionally at risk. If a person doesn't eat well at home and has nutritional deficiencies, he or she will most likely continue with these symptoms when placed in a nursing facility. Healthcare professionals can encourage residents to eat, but they can't force them.
Meeting the nutritional needs and hydration needs of an elderly person is a major challenge. Over 50% of the residents that are admitted to long-term care are malnourished. And they're malnourished because as we age, there are changes in our cognitive status. There is deterioration. We become confused and disoriented. Therefore, it's more difficult for us to communicate our needs and our preferences.
A resident's condition may impact his or her ability to eat or drink adequate amounts. It may be difficult to swallow, or their appetite may have decreased due to diminishing taste bud capacity. Poor appetite or absorption may lead to malnutrition and dehydration, thus increasing the risk for skin breakdown, muscle cramps, fatigue, urinary tract and respiratory infections, undesired reactions to medication, and confusion. Approximately 50% of the individuals residing in nursing facilities and 50% of homebound elderly are diagnosed with incontinence. Incontinence is one of the main reasons elderly individuals find themselves needing assistance on an ongoing basis. When an elderly person is incontinent, it's difficult to pinpoint the main cause. Numerous age-related changes and other risk factors such as decreased activity, estrogen deficiency, and depression contribute to this condition.
A resident's right to choose can also increase the risk of incontinence. Caregivers in nursing facilities encourage residents to drink adequate fluids and comply with toileting needs by encouraging fluids and assisting them to the bathroom. But if a resident chooses not to do these two things, he or she may be at risk for developing incontinence or other conditions, including skin breakdown.
Elderly persons are at greater risk for infections because their normal immune functions and other defenses are weaker and less effective.
Elderly persons in hospitals and those residing in nursing facilities are especially susceptible to infections such as urinary tract infections, respiratory infections including influenza and pneumonia, and skin infections. In addition to their immune systems being weaker, they generally have multiple health conditions that may increase the risk of infections, and when combined with decreased appetite, decreased fluid intake, and perhaps decreased activity level, the problem can be compounded. Antibiotics may effectively treat the infections, but some infections may be life-threatening to the elderly.
Chronic conditions that are more prominent among this age group, such as diabetes or cancer, further impair an aging person's ability to defend against infection. Since infection is passed on from person to person, people staying in a community living setting, such as a nursing facility, are more likely to be exposed to infections than those living at home. At least half of all the elderly living at home experience chronic pain. It shouldn't be surprising then that residents of nursing facilities, who are far more debilitated than most people living at home, will also experience chronic pain. Chronic pain stems from a variety of factors, including fear of disease progression, medication side effects, and often an undertreatment of pain because individuals are reluctant to complain about simple aches and pains. Seniors who have multiple medical problems may experience several types of pain. Risk factors associated with chronic pain include a decline in physical fitness, difficulty walking, depression, arthritis, osteoporosis, constipation, cancer, history of fractures, and post-operative surgical procedures.
Ms. Adams also mentioned this morning to the charge nurse that she may be experiencing pain in her good hip. Can we address that?
I didn't know that. Miss Adams, maybe we need to reduce your sessions by about 10 minutes for the next few days.
What do you think, Mom?
I don't want to lose any ground in my recovery. Maybe we could do it 5 minutes instead of 10.
That sounds fine. We can ask the physician for a little bit of pain relief medication prior to the sessions.
Encourage your loved one to tell her caregivers whenever she experiences pain or any other change in her condition. They can relay this information to her physician and better care for her. Falls are the #1 reason individuals are admitted into a hospital or a nursing facility. 1 of every 3 adults aged 65 years or older falls each year. And most of these falls occur at home or in public places. Only 10% of all falls occur in nursing homes, hospitals, or other healthcare facilities. Falls are the leading cause of death due to injury among persons over the age of 65. The risk of falling is 4 times greater in senior adults who are ambulatory, 3.8 times greater if the person is 90 years old or older, 5 times greater if there's a history of falls, and 7.5 times greater if the older adult has dementia. Combining the first 3 factors increases the risk of falling by more than 50 times. People who are 85 or older are 10 to 15 times more likely to experience hip fractures than are people between the ages of 60 and 65. Changes in the density or strength of bones and muscle mass, along with multiple medication usage, places older adults at risk for falls and injury. Only a small portion of falls can be attributed to a single cause, but some of the reasons people fall include problems with confusion, balance, hearing, and sight.
The causes of falls are known as risk factors that are classified as either intrinsic or extrinsic. Intrinsic fall risk factors include the effects of normal aging, such as vision loss, changes in gait and balance, and osteoporosis. Extrinsic fall risk factors have to do with the resident's environment, such as clutter and lighting, and with equipment such as wheelchairs.
Because the elderly have such brittle bones, they may even experience a fracture as they roll over in bed. A situation like this is unavoidable in any setting. Some people think that physical and chemical restraints reduce the incidence of falls, when in reality, an individual is more likely to suffer a serious injury from a fall when restrained.
While we cannot prevent the effects of normal aging, nor can we cure many chronic diseases, there are things that can be done to improve the safety of a resident's environment. One way is for families to make sure that the resident has well-fitting shoes and slippers with tread on the sole. While some carpeted floors may require shoes with less tread, generally speaking, all shoes should have adequate tread for traction.
LifeCare recently implemented an innovative product that so far has helped reduce hip fractures due to falls. Hip protectors, which were first tested in Europe, are available to all LifeCare residents. This device is nearly unknown to most providers and even to most state agencies, but LifeCare has dedicated more than $2 million to purchase these devices for all residents who need them. By incorporating this innovative protective technique, we hope to reduce the number of fractures in our facilities to less than half the industry average. Aging skin is vulnerable to injury due to thinning of the outer layer of skin, vascular reduction, and increased permeability. Skin of the elderly has been shown to be 7 times more permeable than that of a young person. Like all of the other aging factors we've discussed, the decrease of skin integrity is a fact of life as we age. Under certain circumstances and conditions, skin breakdown and the development of ulcers is unavoidable. Due to a variety of factors, the elderly often have paper-thin skin, which can tear easily and develop a skin ulcer within hours. The development of pressure sores may lie in the natural history of disease progression. Just like signs of heart, lung, or kidney disease, a pressure sore may be a sign of physical decline and mortality. Sometimes the ulcers lead to other conditions, such as a system-wide infection, which can result in death.
Some patients may have risk factors that cannot be modified or resolved. Examples would be the anemia of chronic disease or malnutrition in a person who cannot eat adequately and has elected, per their advance directive, not to receive artificial nutrition. Development of a pressure sore in such situations may be unavoidable despite other preventative interventions and should not be considered poor care.
An individual who takes numerous medications or chooses not to eat or drink or to allow a staff member to reposition them in bed can enhance the possibility of skin breakdown.
Skin breakdown is a big concern for those caring for aging individuals. Under certain circumstances and conditions, skin breakdown and the development of ulcers are unavoidable. As we age, several changes occur that put us at risk for our skin to break. First, our skin becomes thin as we age. The natural lubricants in our skin decrease and our skin becomes drier. All of these factors may cause the skin to tear easily and develop a skin ulcer within a matter of hours. Sometimes as we age, our appetite decreases too, so nutritional intake is a concern. Other factors that place aging or compromised individuals at risk for skin breakdown include medications, the inability to reposition themselves, and moisture on the skin, just to name a few.
Medication use is a risk factor for most all of the age-related symptoms we've discussed today. 87% of all older persons take at least one prescription medication and 3 over-the-counter drugs each day. Most elderly people who are hospitalized or residing in a long-term care facility take 6 to 9 different medications each day. Every medication has side effects, and the more medications taken at one time, the greater the risk of side effects. An individual who averages 8 medications or more each day has a 100% chance of experiencing possible side effects, including altered cognition and increased confusion. Adverse drug reactions frequently seen in the elderly include sedation, fluid or urinary retention, constipation, irregular heartbeat, confusion, falls, delirium, dehydration, incontinence, and weakness. Nurses in our nursing facility give hundreds of types of medication to hundreds of residents each day. We strive to give these correctly in the intervals as prescribed by physicians. However, the government standard for the accurate provision of medications includes a 5% error rate. They came to this conclusion through studies that found that nurses who are being as diligent as possible with administering medication may make mistakes. If you or a loved one has a question about any of the medication prescribed or the intervals it is given, please ask your physician or the director of nursing at your facility. Many elderly individuals suffer from some form of dementia. Their confusion can be the result of numerous factors, including medication usage, depression, and Alzheimer's disease. Alzheimer's disease is a progressive, non-treatable, irreversible neurological disease that affects nearly 4 million persons nationwide. It affects one's ability to recognize, remember, use correct judgment, speak coherently, or complete everyday tasks. Behaviors which are an anticipated result of Alzheimer's disease and other forms of dementia are pacing, wandering, verbal repetition, public sexual expression, hallucinations, or striking out, mental or emotional distress, and disease progression.
Symptoms of Alzheimer's disease progress in a recognizable pattern. These stages or patterns of the disease aren't always the same for every resident, and frequently they may overlap. But staging the disease helps provide us with a framework for understanding the disease, helps us plan for changes that may occur over time in a patient, and helps us plan activities to meet each resident's needs.
The symptoms of Alzheimer's disease can lead to serious health conditions and even death. To assist your loved one in maintaining dignity and self-respect during this time, strive to place him or her in an environment that encourages partnership between family and staff and is designed to meet the special needs of individuals with Alzheimer's disease.
I want to go home. I want to go home.
Confusion or dementia is common among the elderly. A number of people in a nursing facility will be confused. They may scream out, pace, repeat words or phrases, or do a number of things that you may find disturbing.
While there is some forgetfulness that may be associated with normal aging, dementia or Alzheimer's is a disease of the brain that affects our ability to recognize, remember, use correct judgment, and speak clearly. Dementia is not part of normal aging, and it is not a mental illness. Characteristics of the disease such as pacing, wandering, repetitive speech, increased anxiety, or resistance with care provide ongoing challenges for caregivers. Fortunately, we have special care units and even dedicated facilities that are specially trained and designed to care for residents who present with these special needs.
Whether or not your loved one shows signs of dementia, please understand that these behaviors are common in the elderly. It is difficult to see a once vibrant individual scream out in an embarrassing manner or endlessly review the same story to everyone who passes. But it shouldn't alarm you. These behaviors are common to the population within a nursing facility, and life care associates do their best to respond to these individuals in the most appropriate manner possible. But we cannot forcibly stop these behaviors without infringing on the rights and quality of life of the residents. Aging brings numerous challenges to the elderly and to those who love them. Whether for short-term rehabilitation or long-term care, placing your loved one in a long-term care facility may be the best choice for your family.
The nursing home can offer socialization that sometimes is so vitally lacking. That was one of the most important things that the nursing home did for my mother-in-law. She was a tremendously social person, and we moved her to my home where she didn't know anybody and where she was left at the house all day long because we both work, and where nothing fit, and she was absolutely miserable. The nursing home gave her some socialization, which not only made her happier, it made her healthier.
Thank you for selecting Life Care Centers of America. We strive to treat changes in the medical condition and injuries to our residents in a timely, professional, and caring manner. We also strive to provide the safest environment possible by seeking background and reference checks on every person we hire. But the world isn't perfect, and some of the same concerns of safety and well-being that you have for yourself at home are still present within a hospital, a hotel room, a retirement center, and in a long-term care facility. The long-term care environment will create additional challenges for your loved one. First, in a community setting, privacy is minimized. Residents may share a room with another person, and for safety reasons will not be able to lock their doors. A resident's control over sound, light, temperature, and other environmental factors is decreased in a community setting. Food preference choices are also limited by facility menus and doctor's orders of therapeutic diets. Food service staff members can accommodate certain requests, but there are limits, and they can never offer food that goes against a physician's orders. Also, understand that even though your loved one will be residing in a facility with a licensed nursing staff, he or she will not receive 24-hour one-on-one nursing care. Depending on his or her condition, the typical long-term care resident will average from 2 to 3 hours of nursing care within 24 hours. If you feel your loved one needs 24-hour one-on-one assistance, we encourage you to hire a sitter if you have the resources to do so. We'll assist you in arranging for this service. The journey of life is marked by many life-changing situations: birth, marriage, illness, and death. Finding oneself in a nursing facility near the end of life's journey is often frustrating and even depressing. Family members may experience some feelings of doubt and guilt. These feelings are normal. The caregivers at this nursing facility are here to provide quality care for your loved one. To best support their efforts, consistently communicate with them. Mention any changes you've noticed in your loved one's physical or mental condition. Discuss possible ways to handle the changes with your loved one and with caregivers. In addition to immediate caregivers, we also encourage you to discuss any concerns you have with your executive director, the director of nursing or the resident's physician, life care corporate personnel, or the state ombudsman. See your admissions packet for contact information. Dealing with this difficult part of life's journey is easiest when everyone works together to provide the best possible care and support for each resident.
Ashley, you know, you may have to place me in a nursing facility one day, and I want you to know that's okay. Sometimes it's just a part of life.